Thank you, Mr. Chairman. You know, I think this is a pretty exciting hearing. It might seem small and not well attended. The Klieg lights aren't here. But in terms of the future and in terms of alleviating human suffering and saving a ton of money for the taxpayers that we don't have in the future, this may be the most important hearing that we will have all year. And I appreciate the brain power in front of me, and I appreciate having an opportunity to have a little give and take. Senator Coburn, my friend of 21 years now, is back here, and he's looking good, and he's once again making a lot of sense. Senator Coburn mentioned risks, transparency, and peer engagement at FDA. I hope the House legislation is improved on. I hope it passes. I hope the FDA is listening. I would commend to everyone's attention a simple, straightforward bill that I have introduced called the Patient-Focused Impact Assessment Act. This bill was introduced with the help of my friends in the Duchenne community, and it would promote transparency by simply requiring the FDA to share how they use patient and advocate input in the approval process. So I would commend that bill to the attention of the members and suggest that it would be a small step. Let me say how thrilled I am that Chris Frangione is here, and I appreciate the work that he's done with me and my staff in moving toward introducing legislation later on this year to create a prize, working with the X Prize Foundation, trying to work in partnership with the NIH on developing a prize and identifying prizable achievements with regard to curing and alleviating the suffering from Alzheimer's. But Chris, you mentioned that you don't care who wins the prize. You know, it could be somebody that's in college. It can be somebody you hardly expect. A lot of us are reading David McCullough's book on the Wright brothers. Who would have picked out two bicycle manufacturers from Dayton, Ohio, to give a grant to create the machinery that would crack this problem of human flight? As a matter of fact, government agencies on both sides of the Atlantic were awarding grants to other people. But it happened that these people were working toward the formula and used the scientific method and tried over and over and over again over the course of years and actually got it done. So I appreciate what you said about that, Chris. Let me just say that with regard to Alzheimer's, I do think that this may be a critical moment. Mr. Chairman, you mentioned 700,000 people will die this year from Alzheimer's disease. A breathtaking number, but it's also the most expensive disease in America. And of course, we know it's 100% fatal. A report released earlier this year estimates that caring for people with Alzheimer's will cost the United States $226 billion this year, including $153 billion to Medicare and Medicaid alone. In 2015, 1 in 5 Medicare dollars will be spent on someone with Alzheimer's, 1/5. Unless we find a cure or a new drug therapy to halt the progression of this disease, treatment costs will continue to rise. By 2050, the annual cost will grow to $1.1 trillion, including a 500% increase in Medicare and Medicaid spending on Alzheimer's. Over $1 trillion a year to be spent out of the taxpayer's dollar on treating Alzheimer's, a disease which I think we can get to. So thank you, Mr. Frangione, and thank you to your CEO, Dr. Diamandis, for working with my staff and me, and with a group called Us Against Alzheimer's, on finding a way to encourage the government to spur innovation in the Alzheimer's research through prize-based challenges. Later on this year, I will be introducing the EUREKA Act. Ensuring useful research expenditures is key for Alzheimer's, EUREKA. And I will be asking you, Mr. Chairman, and you, Mr. Ranking Member, and all of my colleagues, both in the Senate and the House, to work with us on this. And I appreciate the positive imprimatur of the X Prize Foundation in making us believe that this can work. And in the 5 minutes that I have, I'll just ask one question. You know, with the prize, you pay only for success. Now, how much would we pay? How much would this society pay if for a cure to Alzheimer's? But given these numbers, 100, you know, in 35 short years, we'll be spending $1 trillion a year. How much would society pay for a cure? But I've learned in dealing with the foundation that there are X-prizable steps that get us concrete results and save us concrete amounts of money. So if, Mr. Francione, you could comment on that for the benefit of the committee and explain to us how, of course, the ultimate cure would be a wonderful event that we'd set off fireworks around the world. On Independence Day, we could do that. But how can we have prizable events that get us concretely and amount to success that's worth paying for?
Sure. Thank you so much for your leadership, and Sarah Lloyd and your team have been great to work with, so we appreciate that. So prizes can get you along that spectrum without getting you all the way there at the outset, right? Because getting all the way there is going to be a really, really big moonshot. But there's lots of places prizes can play, and especially as Dr. Yamamoto was talking about, this collaboration, right? So we see in prizes, you could bring together disparate folks to work together on a problem, whether it be people from the engineering community or people from the health community or people from the social sciences or wherever. In fact, I talked about well-designed prizes. One of the things that we do at X Prize is when teams register, we actually ask them, are you missing any components to your team? Are you looking for any other people? And we also allow individuals to register that have specific expertise and knowledge that can then join these teams to build that collaboration. So in the terms of Alzheimer's, you can see a bunch of different steps along the way. Imagine, you know, starting off with finding a prize that can look for the biomarkers or whatever it is that can allow us to diagnose Alzheimer's way earlier than we currently do. Right now, you're pretty far along for us to be able to diagnose you. Or, as an intermediate step, we're actually working on an AI prize. Could that AI prize become an AI human brain augmentation, right? So that you can actually help people with Alzheimer's artificially bring back some of their brain functions. Or, imagine you have a prize out there in robotics. So you're bringing all these people from robotics, so you're creating a human helper to take away some of the burden on family members and the medical community. And you can augment a human with Alzheimer's with a robotic helper. So there's lots of different directions you could go, ultimately on the way to finding that cure. But you can incentivize different steps along the ways. So prizes can find cures or biomarkers. Prizes can help you solve the problem, essentially put a Band-Aid on it, but a really important Band-Aid that will give somebody a much better quality of life. Or prizes can help you do things through AI or big data. So there's lots of things we could do, and we're actually looking at all of those right now at X Prize, as are people outside of X Prize, looking at different ways to augment it.
Thank you very much, and thank you, Mr. Chairman, for your indulgence. Mr. Francione, if someone within the sound of our voices today called you up and had an idea they'd like to share, you'd be happy to hear that idea.
I would be very happy to hear it. And
thank you very much, and so would I.